Hi everyone, this is Dr. Rohit Khatavkar. I am a microendodontist from Mumbai and the course mentor at Vision Microdentistry. Today I will be talking to you about how you correctly use your apex locator clinically and what all things you need to make sure before you start using the apex locator. So let's get right into it. Today, for the purpose of demonstration, I will be using the DentaPort ZX from Ajay Morita. It's one of the gold standard apex locators, and you can check the research also about it. It's one of the apex locators which gives you one of the highest and most consistent reading. Okay, so you have a display over here, and you have the power on/off switch. So when you start using the apex locator, there are a few things that we have to take into consideration. One is that we make sure that the apex locator has the maximum battery. As far as possible, try to maintain the apex locator battery above 50%. So if your battery of the apex locator goes down, for instance in this apex locator, we just need to change the batteries. So I prefer to use regular batteries as opposed to the rechargeable batteries. Certain apex locators have a fixed rechargeable battery which you need to keep charging. So you have to make sure that your apex locator battery is always charged, because that will give you the correct reading. Second thing that I will check is that we will take the two leads of the apex locator and join them together. Okay, what this will do is it will give you a loud audible beep, and possibly in most of the apex locators will show you a reading which corresponds to apex or over. Some of the apex locators you might get a reading which shows two arrows which are pointing towards each other. All these indicate that the apex locator is working properly and is giving you a proper reading. Once these two things are confirmed, then we will move on to the patient and we will start using the apex locator to determine the correct end point of our working length or the working length determination. In terms of the maintenance, there are a few other things that we have to make sure which need to be repeated not after each and every use but on a regular basis to make sure that the apex locator gives you a proper reading. Okay, so there are these two leads which the apex locator has. One is your lip clip which goes on the patient's lip, and the second one has a file holder which is clipped onto the hand or your rotary instrument. So these two leads have to be, you have to make sure that they are clean. Usually they are made out of brass or metal, so they do tend to get oxidized over a period of time. So we have to just remove these out and make sure that they are clean. You can see the shiny surface on both the metals, and if you see that there is a dull surface or you see that there is some kind of oxidation layer that is formed, a greenish or whitish layer, just use a wire brush which we use to clean our burrs, or you can use a thin grade sandpaper and just rub it over this to remove that layer of oxidation. Once this is done, you can place them back and make sure that your apex locator is going to give you that same apex reading. In case these things do not give you the correct reading, there is a possible problem that is there with the wire of the apex locator, which happens most commonly because our assistants or the doctors who are using the apex locator tend to tighten this wire around the apex locator. So make sure that your wire is folded loose and it's not tightened, because that can put a lot of stress on this and can disconnect some of the wires which are connecting the apex locator to the rest of the two leads. Alright. Now with these things in mind, we will now move on to checking how we will be using our apex locator to determine our working length. So we have our extracted tooth here. It's a maxillary molar which has all four walls intact. So this is something that we need to make sure clinically that all four walls of the tooth are clinically intact. If you have a missing wall, we need to build that up with a pre-endodontic restoration. We will talk about this probably in another video. So once we are sure that we have four walls intact, we also have to make sure that the internal surface of the tooth does not have any dry area. So you have to make sure that the tooth is moist or wet, but it should not be full of any irrigant solution, blood or saliva. Okay, so there can be some amount of blood inside the canal which can still give you a proper consistent apex locator reading, but if there is continuous oozing, the apex locator will not give you a consistent reading. At the same time, there are certain irrigant solutions that we use routinely in our clinical practice. A couple of them most commonly used are sodium hypochlorite and EDTA. Amongst these, sodium hypochlorite will give you the most accurate reading. since the salts which are present in sodium hypochlorite will also help with conducting the apex locator properly. So the sodium hypochlorite solution is the most common solution that I recommend to use when you are using the apex locator. In case you don't get a consistent reading while the hypochlorite is in the canal, you can have a little bit of EDTA gel that is applied to the tip of your instrument and then insert it inside the canal to give you the apex locator reading. Now in terms of the instruments that are used for using your apex locator, the 10 number and the 15 number file are the most common files that I would use. In about 70% to 80% of my cases, I would rely on the number 10 file for the posterior tip. In case I have wide canals or short canals, in those cases the 10 number file might be loose. So I would take an instrument, whether it is a 15 or a 20, which is slightly tightly bound at the apex so that it gives me certain amount of resistance when I am using the apex locator and connecting it on the file and moving the file down apically. Okay. So in this case we will use the number 10 file and we will place the file inside the canal and we will put our lip clip over here. Usually the lip clip will be placed inside the patient's mouth on the contralateral side. The second thing that we need to remember is the position of our file holder. So you can apply the file holder from any position on the occlusal surface from here till the end of the instrument, but a better way to do it is to move the stopper down and place it in a position between the stopper and the handle of the file. So anywhere over here is where I would prefer to use the file holder or the file clip. Once that is done, we will place our instrument inside and we will slowly move it down apically and you will start seeing certain changes on the apex locator. Okay. Now when I want to get a consistent apex locator reading, what I would do is I will make sure that I reach a point where the apex locator shows me a point that is apex or over. Once that is done, I will start pulling the instrument back till I get a reading which is at a junction between the 0 mark and the number 1. Okay, so approximately I would go with something that corresponds to 0.5, which is where you can see the green arrow also. Okay, so this is the reading where I would now adjust my stopper and I would consider this as my final reading for the mechanical instrumentation. Now there are different schools of thought on where you would want to end your mechanical instrumentation. Certain authors would recommend you to stop at 0,0. Certain authors would recommend you to stop at 1 or maybe at 0.5. So depending on what school of thought you follow, you can choose to have the end point of your apex locator. My personal preference is to a point which corresponds to 0.5. It's never a reading that is given in millimeters. No apex locator in the world will give you a 0.5 mm or 1 mm apex locator reading. It is only a reading which corresponds to 0.5. So 0,0 is the reading where your file might just be jutting out of the apex, out of the anatomic apex, and I would want it to be 0.5, which may or may not correspond to 0.5 millimeters short of that 0,0 reading. Okay, so because there is an ambiguity over here, I would prefer to go with a reading that the apex locator gives rather than reducing an arbitrary value of 0.5 or 1 millimeter. Okay, so 0.5 reading is the apex locator reading that I would personally choose to end my mechanical instrumentation, which means that every rotary file that I use will stop at this 0.5 reading. So I hope some of these clinical tips that I gave you were good enough for you to understand how to use your apex locator consistently to get a proper consistent reading. If you guys still have any doubts or you need to get some more things clarified, please feel free to write down in the comment section below, and look forward to another video soon.